Loop diuretics. They are high-ceiling diuretics that act in the thick ascending limb of loop of Henle. They are called high-ceiling because they inhibit sodium reabsorption in the thick ascending limb, where about 25% of filtered sodium is reabsorbed, producing the most powerful diuretic effect. The examples for this class of drugs are Furosemide, Bumetanide, and Torasemide. Let us look into the mechanism of action in detail. The luminal side of the tubular cells contains a transporter called sodium-potassium 2 chloride, an A plus K plus 2Cl- cotransporter. Its function is to move one sodium ion, one potassium ion, and two chloride ions from the tubular fluid into the tubular cell. Loop diuretics bind to this transporter and blocks its function. As a result, sodium remains in the tubular fluid. Water follows sodium and this increases urine output. Some of the absorbed potassium then leaks back into the tubular lumen through potassium channels. This generates a positive luminal potential that pushes divalent ions like calcium and magnesium from the tubular fluid into the interstitium through the space between the cells. This is called as paracellular pathway. So if the sodium-potassium 2 chloride channel is blocked by loop diuretics, potassium entry into the tubular cell is reduced, leading to decreased recycling of potassium back into the lumen. Due to this, the positive electrical gradient is lost. So calcium and magnesium reabsorption is decreased, leading to their excretion in urine. Loop diuretics are used in the following conditions: acute pulmonary edema, congestive heart failure, peripheral edema, hypertension, hypercalcemia, chronic kidney disease, etc. The adverse effects include electrolyte disturbances like hypokalemia, hyponatremia, hypocalcemia, and hypomagnesemia. Ototoxicity is seen due to inhibition of sodium-potassium 2 chloride transporter in the inner ear. This can cause deafness, vertigo, or tinnitus, which is perception of ringing sound in the ear without any external sound source. Hypersensitivity reactions like skin rashes, photosensitivity, etc. may be seen. Loop diuretics may also produce metabolic disturbances like hyperglycemia, hyperuricemia, and hyperlipidemia. Hyperuricemia may precipitate gout in some susceptible individuals. At last, we move to drug interactions. Loop diuretics, when given with digoxin, increases the risk of digoxin toxicity. With aminoglycosides, they enhance ototoxicity. When administered along with NSAIDs, the diuretic and antihypertensive effect of loop diuretics is reduced. With lithium, they precipitate lithium toxicity. And that wraps up a high-yield overview of loop diuretics.